11 Signs and symptoms of vitamin B12 deficiency. Vitamin B12 is an essential nutrient that keeps the body functioning properly. Symptoms of vitamin B12 deficiency include fatigue, low mood, and nerve problems. The human body does not create vitamin B12, so people must get this nutrient from their diet. It is crucial for making DNA and red blood cells, and it helps support the nervous system. Vitamin B12 plays a vital role in the production of blood cells. Many of the symptoms of vitamin B12 deficiency arise because it causes a lack of healthy blood cells. The body needs plenty of these cells to get oxygen around the body and keep the organs in good health. A vitamin B12 deficiency can lead to both physical and psychological problems. In this video, we explore 11 symptoms of vitamin B12 deficiency and explain why they occur. What to know about vitamin B12 deficiency? Vitamin B12 deficiency may affect between 1.5 and 15.0% of people. This deficiency can cause a wide range of symptoms that affect a person's mental and physical health. It is important to consume foods that contain vitamin B12 on a regular basis. Adults need around 2.4 micrograms (mcg) of vitamin B12 each day. Vitamin B12 is a water-soluble vitamin that is present in animal-based foods, such as red meat, poultry, eggs, dairy, fish. If a person does not eat animal products, they will need to add vegetarian and vegan sources of vitamin B12 to their diet. These include fortified cereals, plant milks, bread, and nutritional yeast. As vitamin B12 deficiency shares many symptoms with other nutritional deficiencies and health conditions, it is possible that people may neither notice it nor get a diagnosis. Being aware of all of the signs can help people identify the deficiency and seek treatment. 1. Tingling hands or feet. Vitamin B12 deficiency may cause pins and needles in the hands or feet. This symptom occurs because the vitamin plays a crucial role in the nervous system, and its absence can cause people to develop nerve conduction problems or nerve damage. In the nervous system, vitamin B12 helps produce a substance called myelin. Myelin is a protective coating that shields the nerves and helps them transmit sensations. People who are vitamin B12 deficient may not produce enough myelin to coat their nerves. Without this coating, nerves can become damaged. Problems are more common in the nerves in the hands and feet, which are called peripheral nerves. Peripheral nerve damage may lead to tingling in these parts of the body. 2. Trouble walking. Over time, peripheral nerve damage resulting from vitamin B12 deficiency can lead to movement problems. Numbness in the feet and limbs may make it hard for a person to walk without support. They may also experience muscle weakness and diminished reflexes. 3. Pale skin. Pale or yellow skin, called jaundice, may be a symptom of vitamin B12 deficiency. Jaundice develops when a person's body is not able to produce enough red blood cells. Red blood cells circulating under the skin provide it with its normal color. Without enough of these cells, the skin may look pale. Vitamin B12 plays a role in the production of red blood cells. A vitamin B12 deficiency can cause a lack of red blood cells, or megaloblastic anemia, which has an association with jaundice. This type of anemia can also weaken the red blood cells, which the body then breaks down more quickly. When the liver breaks down red blood cells, it releases bilirubin. Bilirubin is a brownish substance that gives the skin the yellowish tone that is characteristic of jaundice. 4. Fatigue. Megaloblastic anemia due to vitamin B12 deficiency may lead to a person feeling fatigued. Without enough red blood cells to carry oxygen around their body, a person can feel extremely tired. 5. Fast heart rate. A fast heart rate may be a symptom of vitamin B12 deficiency. The heart may start to beat faster to make up for the reduced number of red blood cells in the body. Anemia puts pressure on the heart to push a higher volume of blood around the body and to do it more quickly. This response is the body's way of trying to ensure that enough oxygen circulates through all of the body's systems and reaches all the organs. 6. Shortness of breath. Anemia that results from vitamin B12 deficiency may cause a person to feel a little short of breath. It is possible to link this to a lack of red blood cells and a fast heartbeat. Anyone who is experiencing real difficulty breathing should see a doctor straight away. 7. Mouth pain. Vitamin B12 affects oral health. As a result, being deficient in vitamin B12 may cause the following mouth problems. Glossitis, which causes a swollen, smooth, red tongue. Mouth ulcers. A burning sensation in the mouth. These symptoms occur because vitamin B12 deficiency causes a reduction in red blood cell production, which results in less oxygen reaching the tongue. 8. Problems thinking or reasoning. Vitamin B12 deficiency may cause problems with thinking, which doctors refer to as cognitive impairment. These issues include difficulty thinking or reasoning and memory loss. One study even linked low vitamin B12 levels to an increased risk of Alzheimer's disease, vascular dementia, and Parkinson's disease. The reduced amount of oxygen reaching the brain might be to blame for the thinking and reasoning problems. 9. Irritability. Being deficient in vitamin B12 can affect a person's mood, potentially causing irritability or depression. There is a need for more research into the link between vitamin B12 and mental health. One theory is that vitamin B12 helps break down a brain chemical called homocysteine. Having too much homocysteine in the brain may cause mental health problems. 10. Nausea, vomiting, and diarrhea. Vitamin B12 deficiency can affect the digestive tract. A lack of red blood cells means that not enough oxygen reaches the gut. Insufficient oxygen here may lead to a person both feeling and being sick. It may also cause diarrhea. 11. Decreased appetite and weight loss. As a result of digestive problems, such as nausea, people with vitamin B12 deficiency may lose their appetite. A decreased appetite can lead to weight loss in the long term. Why is vitamin B12 important? Vitamin B12 is vital for the formation of red blood cells, RBCs, that carry oxygen around the body. It is also needed for the proper functioning and health of nerve tissue, as it is involved in producing the protective myelin sheath that covers the nerves and conducts nerve impulses. It works together with folate in the metabolism of cells, DNA synthesis, and the metabolism of fatty and amino acids. This particular B vitamin also helps our bodies absorb folic acid, which facilitates the release of energy. Because your body doesn't make vitamin B12 on its own, it is important to get it from food sources, especially animal-based foods, or supplements on a regular basis. In order to avoid any undue complication, it is always recommended to consult your doctor before starting any supplement regimen. Causes. Even if a person gets enough vitamin B12 in their diet, some underlying health conditions can affect the absorption of vitamin B12 in the gut. These conditions include Crohn's disease, celiac disease, atrophic gastritis, pernicious anemia. The following factors make a person more likely to have a vitamin B12 deficiency. Being older, because a person becomes less able to absorb B12 as they age. Eating a vegetarian or vegan diet. Taking antacid medication for an extended period. Weight loss surgery or other stomach surgery, which can affect how the digestive system absorbs vitamin B12. Vitamin B12 deficiency is common and can present itself in various ways, making it difficult to identify. If you are at risk and have any of the symptoms above, speak to your doctor. For most people, a B12 deficiency should be easy to prevent simply by ensuring you are getting enough B12 in your diet.